Would you tell us the statistics regarding deaths by overdose in Portage County from 2011 till present?
Welcome, everybody. It's great to see this many people in our community attending an event of this nature. Dr. Mallory has put on the screen there the statistics that you just spoke about, and you can see that there's been a dramatic increase in the deaths from both from heroin and fentanyl since 2011. In fact, this data for 2016 was from Monday, and since then we've had one more confirmed and we have 6 pending overdoses. One of the issues I would just mention now is that brought up earlier today by our presenters was the carfentanil. So the thing to remember is that folks are dying from heroin and heroin laced with things like carfentanil. And a snowflake size of carfentanil is lethal. A slide was on the screen from a Canadian drug bust about 10 years ago, where they were wearing hazmat suits. Carfentanil can be 10,000 times stronger than morphine. One of the problems we have is that we think we have 3 carfentanil deaths so far in the county. Why do I say we think? Because we've had 1 confirmed by toxicology, but 2 deaths of people who were in a milieu of drugs, but we couldn't find a cause of death, and my administrator had the drug task force present the paraphernalia they found to the toxicologist in Sumner County, who we use, and he found the carfentanil in the tubes and the bags that they had. When we asked him about it, why we didn't find it in the body, he said because it can act so quickly that it may not have time to distribute throughout the body. So this is another whole level of drug issues we have that we're going to be only seeing, I'm afraid, more and more of this issue. Thank you.
Can I add a caveat that I always explain to people when you see these kinds of statistics? These are people who only die in Portage County. We have lost numerous residents in other counties that you don't see up there on those charts because people from Portage County are going to Alliance, Cleveland, Akron, wherever to get their drugs, and so many times the overdose occurs as soon as they've gotten their drug and they've taken the drug, and that's oftentimes when the overdose and the death occurs. So you probably all know somebody who isn't one of those statistics because they've gone outside of the county and have, injected themselves somewhere else and have died doing that. So again, these numbers are maybe for some of you aren't shocking, but understand that there are many, many more of our residents who are no longer with us, who aren't part of those statistics.
Thank you, Judge Oswick. Sheriff Doak, how is the opiate epidemic impacting local jail and overcrowding, such as the estimate that over 75% of inmates are presenting with drug alcohol issues? Over the past 3 months, how many inmates are detoxing from drugs and alcohol?
Wow, that's an interesting question. How many of you in here, let me see a show of hands of anybody who's ever seen anybody detox? Oh, quite a few, okay. That's not a pleasant experience, and unfortunately, we see this continually in the jail. The numbers are increasing in the jail continually. The largest problem that we have is among the female gender. In the past 5 years or so, we are permitted to have 34 maximum females in the jail. One morning I came into work about 4 months ago, we had 78. We were literally stepping over bodies in the jail. And it has created a real issue as far as, what to do with people who are addicted, how to handle them, who we're going to keep, who we're going to let out, and so forth. The morning that happened, I literally called one of the commissioners and I said, I'm closing the jail. And she said, I don't think you can do that. And I said, I just did. I cannot have 78 inmates in a female pod and not have the ability to watch over the inmates and care for their custody and control and staff members as well. So consequently, short time after that, they imposed a tax, and we're in the process now of probably building onto the jail. But we are not going to arrest our way out of this situation. Rehab is a much needed part of the whole problem, in my opinion. Is it Kelly?
Yes, sir.
You have reinstated my faith in mankind.
Thank you.
I can tell you that we need more success stories like that. And when we see the numbers declining in the jail, then we're going to realize that we're making an impact and we're going somewhere. And that's not the case now. I can tell you honestly that I think law enforcement collectively across the board, some of my counterparts in the back room here, State Patrol, and even some of our corrections officers are here. We are so far behind the eight ball with this drug epidemic that I'm not sure. I know I won't see it in my career. We're just not going to get ahead of this in a short period of time. It's going to be a long-term thing. So I hope that answered your question.
I do have some statistics. I just actually got from the jail. We had a jail meeting a week ago. And from January through the end of September, people that were they were watching for detox, there were 400. I think it was 423, and over close to 65% of those were due to opiates. The largest detox facility and inpatient psychiatric facility in Portage County is right with Sheriff Doak. That's the truth.
Thank you. Mr. Muldowney, how many cases are coming through the courts that are related to drugs? Possession, trafficking, manufacturing, theft? What percentage of children are being removed from their homes into DJFS custody due to their parents' drug and alcohol addiction?
Good afternoon, everyone. I'm happy to be here. Thank you for inviting me. I've been with the Common Police Court up in Portage County here since 1990. And when I first started up in Judge Keenerad's court, we had approximately 12 to 15 cases a month. We'd have pre-trials that would start on a Friday morning, and sometimes would be done by early afternoon or late in the morning. Today, we have cases in my court, which is under Judge Lori Pittman. The number is about 70, I'd say on average 70. Sometimes more, sometimes less. Back then, maybe a third of the cases were drug-related. They had to do with cocaine. Today, I would say at least 85% of the cases that we have up in Common Police Court, the root of the problem is drugs, whether it be a mere possession case where someone's caught possessing heroin, or a case where someone's breaking into your house with a gun, looking for your TV or jewelry or whatnot to pawn off to get heroin. So it has increased dramatically over the years. In terms of juvenile court, Judge Berger would probably be able to answer this question better than me, but the information that I've been able to gain from my office is that in 2014, 19% of the parents in removal instances, where the Department of Human Services removes the children from the home because of their safety, lack of safety and welfare, are directly drug-related. In 2015, that went up to 25%, and in 2016, this year, and it's not over yet, it's at 42%. We believe those numbers are low, and the reason we believe those numbers are low is because those numbers only reflect instances where the children are removed solely for drug-related offenses, such as if they find a meth lab in your house. There are many other cases where the police may get called because of domestic violence, or uncleanliness in the house, or things things as small as the children not showing up for school, and then it turns out the root of the problem is not the uncleanliness of the house or the domestic violence. It happens to be drugs, whether it be heroin, alcohol, or whatnot.
Thank you.
You're welcome.
This question is for the judges. What are the mental health and drug specialized courts, and how do they work? Why are they a good idea?
Hello, I'm Judge Doherty. I feel very strongly about drug court and about mental health court. They are diversionary programs which, at the end of the day, if you're successful, at least in my situation, I have 2 tracks with our drug court. The first track is, we call it the ILC track, meaning it's intervention in lieu of conviction. If you are successful in your treatment program and you get through the year, or 1 year to 2 years, and you get through our program, then your felony charge will be dismissed. The other track is a post-conviction track, meaning drug court is not just for folks who don't have a prior record, but in some instances it's appropriate that even if you do have a prior felony record, you can become involved in our drug court. It is a very hands-on treatment team approach, and we have to be very selective, quite frankly, of who we allow in the program. I just received information from the Supreme Court today indicating that they want the specialized dockets, including drug court, to allow drug traffickers into drug court. I am absolutely 100% against that. So I'm kind of battling with the Supreme Court now, getting our certification for drug court, because we see it on a day-to-day basis. We see what allowing a trafficker who generally, they're not users themselves, they just traffic in drugs, allowing them into a very close-knit treatment team approach is not going to benefit the drug addicts. It's just not going to. So, I think a lot of the benefits from drug court are, and what I've seen so far, are the camaraderie that comes from being in that kind of a situation. They meet together every week. The treatment team is involved. Probation officers, we have a fabulous probation department through Portage County Common Pleas. They work so closely with these folks. And it really is just it's kind of a microcosm of anybody who's on probation, but we take that and really amplify it. I know that Judge Oswick's mental health court is set up very similarly to how drug court is.
Thank you, and I also appreciate all of you being here, because we're all in this fight together, and it is a fight, and it's not a fight, it's a battle, and it's a tough one. Our mental health court derived from, actually, were many years ago, about 12 years ago, we formed a mental health diversion program, and as time went on, it was very successful, similar in nature to what Judge Doherty described, but what happened to us was, all of a sudden the state of Ohio said, well, if you're not a certified specialty docket, that's what we're talking about, where the Supreme Court comes in, gives us very strict requirements. If you are not a certified specialty docket, you can't get any money. We had never gotten money, but we were to the point where we needed money. I mean, we are running these courts on shoestring budgets without any extra personnel, basically relying on the probation department to do 110% for us. So, we finally said, there's money out there, we need to certify. And it is a rigorous program. At the end of the day, what we are doing now that mental health court, which is in the municipal level, is certified by the state of Ohio, to be honest with you, we haven't changed the program that much because it is successful, but at least we're now in a position where if the state of Ohio sends out grant proposals or grant requests, we can at least attempt to get some money to be able to get more personnel. So, at the end of the day, we're all kind of in the same boat. There aren't enough of us, and there are too many of the people who are affected. Obviously, mental health, people with mental health issues are not necessarily drug users. Many times they are self-medicating, And a lot of the people that we actually deal with in our program, I don't see so much of the heroin use in our program because, quite frankly, they're not going to be very successful. I mean, they have to get tested and they have to be clean. If they're not clean, they're gone. And I would say that those people are probably more likely to have felony records that are being dealt with in common pleas. Municipal court is, I call it basically, the court of the sinner, not the criminal. Maximum 6 months in jail, maximum fine, $1,000. People don't go to prison. But what we're attempting to do with this mental health court is to, reach more the first-time offenders and try to change their behavior at that level so that it doesn't escalate. Again, a lot of what we deal, we work very closely with Coleman, Town Hall 2, Family and Community Services, put people into programs. The state of Ohio requires that there are 4 levels, and they have to pass one level before they can pass on to the next level. It's user friendly, I think, for the participants, and just like drug court, people really they bond. They become friendly. I think it's a really great support system for them. But at the same time, they have a lot of responsibilities, and the people who jump through those hoops and are successful, which in our case, again, because we're not necessarily dealing with people who are serious drug users, they may be more self-medicating, and we're hoping, again, to be successful in reaching them at that level before they go any further. And I think it's working at our level, but everything, even though we're misdemeanor court and we're not dealing with most of the heroin offenses are felony offenses, it all trickles down to us. And I would say that probably 65% of the people I deal with have addiction problems. So.
Thank you. Dr. Welsh, what is the relapse philosophy for the Coleman program? Will an individual get suspended?
That's a good question. Actually, like I mentioned, we meet as a team, discuss everyone in our program, both in the referral process and people that are actively being prescribed. So we do find that people will test positive for drugs that are not supposed to be in their system. So part of the process, if that occurs, sometimes it depends on the drug actually. If it's fentanyl or something strong, then we're going to tell them you need to go to rehab. Obviously this isn't working. If it's pot, which is common, and we're not going to accept marijuana on a regular basis, but that's when we just increase the level of care that we're giving them. If somebody tests positive, like I mentioned, I don't want them to be prescribed benzo, and we had recently somebody who tested positive for benzodiazepine. She said she thought it was something else, and she took it, and it ended up in her system. So she was not on daily dosing at that time. She was on twice a week because of her work. We went back to daily dosing. So there are several steps we'll make. There's been other sanctions that we might have to put into place, like if they, we had somebody who had forged their AA attendance, where they had, it was really bad forgery. It was a month's worth. Yeah. So again, that's when we step in and say, I'm not going to prescribe you Suboxone if you're not doing your part. So there's a lot of accountability. We do try to get this is sometimes where we have disagreements among our treatment team, which is how we sanction someone. And I don't want to take someone off Suboxone and cause a risk of relapse. It is there for a reason. It is to keep that person on a low dose of an opiate, to keep them from craving so they don't go use. And that's its whole purpose. So I'm trying to keep them on the program when I can. But if they're not doing what they need to do, then we're just going to up the level of care. We refer people to IOP and other modalities. But thank you for the question.
Thank you. Okay, Dr. Mallory, what are the services that are either currently available or are being developed in Portage County for people with substance use disorders?
The mental health Recovery Board, we're basically a planner, a funder, and we monitor services. So right now, most of our funding used to come from the state. Most of our funding now comes from 3 local levies. And you'll see some people walking around with issue 29. It's one of our 3 levies that we have. But now, these 3 levies now account for about 70% of our funding here in Portage County. The majority of funds come into our board, and they go out to 4 of our agencies, and those include Home and Professional Services, Town Hall 2, Family and Community Services, and Children's Advantage. So those of you who are Portage County voters, we appreciate your past support, and we appreciate your support here in November as well to continue the funding. We now have, it used to be called an oversight committee, but it's now officially known as our Portage Substance Abuse Community Coalition. And basically, this has been meeting actually for about 4 years. We changed its name because it was called an oversight committee, but we wanted to make sure people know this is a community coalition. It's within Portage in dealing with substance abuse. We also have 3 committees. There's a prevention committee, a treatment, and an advocacy as well. We are now meeting on a monthly basis. It's the first Thursday of the month at 1 o'clock at the Kent Free Library in downtown Kent. We do prevention programs. Town Hall 2 is our lead agency doing prevention programs in the schools. There are DARE programs through the police and the sheriff's departments. There's a red flag, which is focused more on mental health issues and suicide prevention, but that's often very tied into kids getting involved with drug and alcohol as well. We have a full range of outpatient services, diagnostic assessments, individual and group counseling. Dr. Welsh talked about the medication-assisted program that has started at Coleman about a year ago. Town Hall 2, in collaboration with ComQuest. ComQuest is an agency that's been functioning for many years in Stark County. They are working with Town Hall 2, hopefully soon, because Town Hall 2 just renovated their old medical clinic into a space where Suboxone and Vivitrol treatments will be coming soon. Project Dawn, you've already heard about. I mentioned about we have 2 detox facilities outside the county, but most importantly inside the county, and let's see, where is Renee Clary? Renee, stand up just for a second. Renee is with the University Hospital's Portage Medical Center, and hopefully sometime in the next month or so, the goal is to have a program which they call a medical support for drug alcohol withdrawal. And basically they're looking at people in terms of treating their symptoms, looking at this as really a chronic disease of addiction. It's not really a separate unit. They're admitted to a medical floor, and it's really helping them either go into abstinence or perhaps they would get inducted into Suboxone or perhaps the use of Vivitrol. So for once, Portage actually is in the forefront of something, and I really appreciate University Hospitals and Renee for getting this to us. We do have 2 residential facilities, one for men, which is Root House, and one for women, which is Horizon House. There are 90-day facilities, and those are run by Family Community and Town Hall respectively, as well as 2 sober living houses. It's one at the park, is the Portage Area Regional Recovery Center, and we also have Otter, On Track to Recovery for men. And finally, we also have the driver intervention programs. I just get involved with those and referrals to them. And we also have individuals, Town Hall 2, Coleman, that are going out to the jail. We currently have a grant that's helping increase the drug assessments and treatment out of the jail, as well as helping people re-enter back into the community, because that's always a problem as well. And that's a joint venture with Town Hall 2 and Coleman. Thank you.
Thank you. Okay. Question from the audience. Doug Doherty or the panel in general. Supply and demand is the driving force behind any business. With all of the addict demand issues, what are we doing to intercept the supply, drug dealers and traffickers? Is it strictly punishment for dealers and an option? So is strictly punishment for dealers an option?
One of the problems that I run into, as well as I know the prosecutor's office does too, right now where it stands, statutorily, I cannot send a low-level drug trafficker, meaning an F4 or an F5 felony, if they don't have any prior convictions. I cannot send them to prison. Now, I think that's ridiculous, because quite frankly, my opinion is if you're trafficking in drugs, you need to be off the street. Now, maybe I can accomplish that with local incarceration or something, but a lot of times I think it behooves the community to incarcerate this person, not only for punishment, but to protect the rest of the community. So a lot of times my hands are tied as a judge, and the prosecutor's hands are tied in terms of recommending a prison sentence. Now, that being said, yes, I can place traffickers on probation and monitor them very closely, but what I see, and I think it's probably consistent maybe throughout the panel or law enforcement, the folks who are trafficking, especially in heroin, are not using heroin. They're trafficking in it, but they're not using it. They don't use their own product. And so if I had the ability to send even the low-level traffickers, because it's a lot harder to arrest and convict the folks who are in the higher-level position, but the low-level people, if I could send them to prison first time out, I think that would have a huge impact on our trafficking community. But I can't because of the way the law is written. If it's a low-level felony, I have to put them by law on probation. So, in answer to your question, yes, I think there is a big difference. That's why I'm so against allowing those who are trafficking into drug court or diversionary programs, because it quite frankly just opens up a whole new avenue of customers for them. So, I think sometimes the legislature and even the Supreme Court, and I'm not saying it to be offensive, but they aren't on the front lines. They're not dealing with this every single day in court like we are, or on the street like these folks are. So, sometimes I think there is a huge disconnect between what our state government sees as being helpful, but really, when we're dealing with it every day, it really hurts our ability to protect the community that we're trying to help. I hope that answers your question.
Thank you. Next question. I'm going to assume this is for Joel Mallory. What are the harm reduction initiatives proposed for Portage County as mentioned in the community health assessment?
Well, I think the biggest one we have right now is the naloxone, the DAWN program, Project DAWN, the decimated with naloxone, because I think that's where, and there's been a lot of complaints, let's be honest. I hear a lot of things in terms of, these people, we should not revive them, or we revive them 3, 4, 5 times. My statement to that is our board is into saving lives. We prevent suicides, we have a slide on there, we try to prevent deaths. And we know people, sometimes it does take, unfortunately, they've overdosed several times, but they've changed. They're in recovery now and so on. And these are sons, daughters, mothers, cousins, relatives. So it's something where we feel that's our major harm reduction. But as I said, we've just started this process with the CHIP program, and basically the Portage, we're going to get it wrong now, Substance Abuse Community Coalition is really the subcommittee connected with the health department in the CHIP program. So we appreciate your input. Hopefully you're writing things down, and if you can't come to the meetings, that's fine. We'll make sure your information gets to us.
Thank you. I'm going to combine a couple of these questions because they all relate to carfentanil. Why would someone use fentanyl or carfentanil if they have been using heroin? Do they care how dangerous it is, and where are they even getting it?
This question for me. That's a good question, because that was a question that was asked initially when the information came out about carfentanil, when it made the news. It was asked many times, why would someone use something that would kill them? In fact, it's being sought out, and that is the whole irony and the hazard and the irrational mind of an opiate addict, which is they want to feel that high again. So when you use heroin for the first time, and it sometimes surreptitiously happens even with pain medicines, where the person feels a sense of well-being and goodness, and it can even escalate to a feeling of euphoria, and even likened to a feeling of an orgasm, and you want to feel that way again, but you can't. When you use it again and again, you develop tolerance. With the tolerance and the dependence comes withdrawal. So you want to avoid withdrawal, and suddenly you're using and chasing just to not have withdrawal. So when things like fentanyl and carfentanil get advertised on the street as being a euphoria and a high and stronger than heroin, it sounds very attractive to them. So even though we put the word out, this can kill you, even small amounts, we don't even touch it. It's actually, there's actually a desire for it. I will also say that people don't know it's in the heroin. So that's the other big issue. Nobody wants to use it, and why people put it in, this is coming from labs in China, labs, illegal labs everywhere in the world can make this and sell it, and it hits the street, and they're just told this is really strong, it's really great stuff, and that's what users are looking for. So it's really unfortunate, really dangerous stuff, but you can't tell as much as you want to. Heroin, people addicted to opiates, this may kill you. If we could tell them that, then we wouldn't have a problem. So, thank you.
And can I add, too, that what we see mostly are folks who are using, they believe that it's heroin and it's either laced with fentanyl or it's pure fentanyl. I had a trial a couple months ago, and it ended up that this kid used pure fentanyl and he died immediately. So, and thinking that it was heroin. So yes, I think they're seeking it out to some degree, but generally what we see in court and through law enforcement is somebody using what they think is heroin, don't realize that it's laced with fentanyl. That's generally how it comes, at least in front of the courts.
And what my office does is we would charge somebody that provided something like that with corruption of another with drugs. And as Judge Doherty just explained about the 4s and the 5s and her inability to send them to prison, corruption of drugs is a second-degree felony, and it carries a mandatory prison term of up to 8 years in prison. Last month I sat down with 2 young individuals who were provided pure fentanyl in a trial that I had, and I asked them, because they had took part of it at one time and then the next day took some more, and both of them fell out. That's what they call it. These young men, they call it falling out. In other words, they go unconscious to the point of in their terms, they believe they had died and they had to be brought back by each other. And then they went to use it again. And the same thing happened, and one of them ended up in the hospital, and that's how we were able to build our case against this individual. We actually tried it. He was found guilty and sent to prison for, I believe it was 11 years. But I asked them, they were sitting across the desk from me, and I asked them, why would you put something in your body when you know it can kill you? The last time it almost killed you. And the answer was that they just didn't care. And it's sad, but that was their answer. It just defies imagination. But they wanted that high so bad, they just didn't care.
Thank you. The next question. What determines if a person gets jail time or sent to a rehab center?
I guess it depends. In my court, and I think I speak for, maybe I can speak for most judges, it depends on their willingness to go into a rehab facility. We use NeoCap, which is the actual facility is in Trumbull County, but it's a lockdown facility. You can't walk away. You're truly locked down, and it's, in my opinion, a very effective program. But I do have a lot of defendants who come before me and say, you know what, I'd rather go to prison. Send me to prison instead of sending me to NeoCap. I don't want treatment. I would rather just go to prison and do my time and be done and walk out and not be on probation and not have to go through rehab. So, yeah, so what I do, I talk to them about it, and I have them assessed for NeoCap because it truly is a good program, but not if you don't want to. Not if you don't want to go in there and give it everything you have and make a change in your life. And unfortunately, it really boils down to the individual. I don't make the decision in a vacuum. I get the pre-sentence investigation. I find out how many attempts at rehab they've had before. I find out how many times they've been unsuccessful and not even gotten through a program. So all of those things factor in to whether or not I will give somebody another opportunity to go into rehab or incarcerate them for their own good sometimes. I had a girl the other day that literally, I've been dealing with her for 2 years. She just a devastatingly bad heroin addict. I even got her in a Vivitrol program over the last few months, and I've been doing this for 2 years with her back and forth. She had 8 years in prison hanging over her. I mean, she has a huge prison sentence hanging over her. But my probation department and I and everybody worked with her nonstop, and she still, even after Vivitrol, she took 1 dose and never would go back. And I sent her to prison yesterday for 8 years because at least her family can visit her in prison, quite frankly. She's overdosed 5 times, I believe, and been revived by Narcan. Luckily, she hasn't had fentanyl yet. She just happened to not take anything that had fentanyl in it because Narcan revived her. But sometimes that's what forces my hand. I mean, I have to incarcerate you sometimes to save your life. And in that case, her family can see her. She's not dead. She's not buried. They know she's living. They know she's, surviving. It's not the best solution, but if I can't get you into rehab because you don't want to participate or you won't take the help, that's a lot of times what dictates what I do.
And on my end, again, at the municipal level, I find that there's a lot of lip service about, I want to go to rehab. I really need rehab. Put me in rehab. And I'll say, okay, I'm going to stay in jail, I'm going to be interviewed, and at the municipal level, that we only have available to us the opportunities that Joel mentioned. We have a few beds at Woodhouse and a few beds at Horizon House, and that's it at the municipal level. We cannot access NeoCap because those are for the felony offenders. So, bottom line is, they tell me, okay, I really want rehab. Okay, you say that, I'm going to have you interviewed. And, when I tell them it's 3 months, you're staying there, whatever, I will say very few people have taken advantage of the opportunity that I have offered to them. I have them interviewed and find out, no, they don't really want to do it. They think I'm going to let them out of jail if they tell me that they really want to go to rehab. So, it's difficult to find those people who are sincere about wanting to change their lives.
If I may just take this opportunity to remind this audience something a lady in the audience taught me 2 years ago, Mim Cherry, said that people who suffer from substance use disorder are not bad people trying to get good. They are sick people trying to get well. And I think we have to pass that gospel out to our friends and neighbors. I know that law enforcement in this state is understanding that it is a chronic disease that may be a lifetime disease that needs to be treated. And I think that's why the judges here, our prosecutor, and our panelists see this constant recurrence of the same folks standing up in front of them. I don't think any of us would think anybody would want to keep going through that if they could possibly solve it.
Just wanted to add a little bit of what has been said here. I am a repeat offender in front of both of these judges here. And thank God, like I said earlier, for second, third, fifth chances, because, you know what? I did care that I was putting poison in my body, that it would kill me. I did care. But you have to understand the power of that illness, the power of that substance, the power of that mental obsession. It wasn't enough. It wasn't enough. Knowing that it could take me away from my wife, knowing that it could take me away from my children, it wasn't enough. Yes, I did care. And every time I was sentenced to a treatment facility or Town Hall 2 or to AA meetings, a seed was planted. And I wasn't given up on. I wasn't given up on. I was loved. I was taught by many counselors in this room, and I wasn't given up on. Not by them, and not by these counselors, and not by my family. So I did care. I'm not this crazy criminal man out there causing issues. Yes, I was doing what I had to do for my active addiction. the active addiction. Well, I don't know. You know, I just wanted to add that you have to understand when somebody's in that mental obsession state, there's a difference. There's a huge, huge difference. It's not an excuse by any means, but there's a difference. Thank you.
Thank you. I can't think of any better way to close out today. I'll hand the microphone to Joel for the end. I do want to remind everyone to please fill out your sheets and hand them to Veronica in the back before you leave, because they're important. We're taking what you're giving us and we're going to do something with it, so you do have a voice.
Thank you, Becky, and I do want to thank Dr. DePerro and Kelly at the end. It was a perfect ending to, we're dealing with people, real people that want to get well. So thank you for that.